Oh my goodness. When I say the struggle is real, I am not lying. So I had my surgery. I think I did well. I woke up, felt fine. Um, Drove myself to the hospital, drove myself home. I was kind of slick. Had my friend pick me up, but then I drove myself home. Um, Came home. Every pharmacy that I went to did not have any pain medication. So I said, forget it. I'm tired. I need to take a nap. I went home and I slept. I wake up. As soon as pain would come, I'd be like, ooh, knocked out. Would go right to sleep like it's a coping mechanism. Got my little Superwoman shirt on today, and I felt like I handled it like Superwoman. So I went to the doctor for my follow-up, and they have something called IV therapy where they like push nutrients into your bloodstream. Okay, so I look like I tried to commit suicide with all this bandage on my arm. When I say I had a boil, like a little baby boil on my arm, this girl, well, I don't know if you can actually hit the bone, but this girl hit the bone in my doggone arm or something. All I felt was radiating pain shoot up my arm. Now, if you know me and you don't, I can go to 10 real quick. I screamed, I hollered, I could have fought her, except my hand was hurting. I would have lost. So I don't know if any of you are up for IV therapy afterwards. I think this is something new and it's beneficial. I think that it is something beneficial, but if you don't do well with needles, if obviously she's gonna tell me my veins are small because I'm overweight. All these, what about 1, 2, 3, 4? The other 4 people who are also overweight, I don't see none of them screaming and crying. I think you, my vein rolled and you was like, oh, I'm gonna find it. This ain't golf, or I don't know what the hell she thought. Let me get my life. I'm still feeling some kind of way about this right now. I felt like she was digging for it, and I know that she had to blow my vein, because when I say my arm still hurts, it still hurts. I was supposed to be there at 8:15. I got there at 8:30. I got pulled in around 9:15. She stuck me once on this side, and even right here, I don't know if you can see it, there's a little ridge right here. But this one was a doozy. I didn't even get the IV therapy. If I die tomorrow, oh well, because I'm not going to let you dig into my bone marrow when you're supposed to be giving me an IV. And since when were IVs right here in these veins? At the hospital, they got me here. And then I know they draw blood from here. What the hell? Oh, I'm sorry. Let me get me again. So, as far as pain going through the procedure, I'm fine. My stomach doesn't hurt. The only pain or ache that I have, and it's not a true pain, but it's an ache, is in my neck and radiating out to my shoulders because of the gas, they say. If you let me tell the story, I believe when they was moving me from the gurney to my bed where I was going to rest at, they let my head just bobble any kind of way, because my neck hurt all the way up in here, like radiating up to the ear. And I know that has nothing to do with gas. Gas should be all in the cavity right here. That's it. So I'm not a doctor, not a nurse. I went to school to almost be a nurse, so that's how I knew this girl done dog walked my arm. She better be glad that I know the Lord, because she could have got dog walked herself. It's not a game. The struggle is so real. People talking about, oh, it's the easy way out, this, that, and the third. It is not. And I'm only post-op like 4 days. So I know I'm not getting poked no more. I know that. Y'all got to put me under first. And that's how I feel about the situation. I will say this. It's working already. I've already lost like 3 pounds, according to my scale at home from when I weighed in that morning. So it's working. Maybe because I haven't had nothing but 2 sips of blue Powerade from Sonic and water, the little the little small, I think that's like an 8-ounce water, those little small waters. But yeah, it's working so far. But my advice to anybody, if you are electing to do the IV therapy from your physician, that you drink as much liquids as you can, because that may be an inhibitor on them finding your veins. And make sure that whoever is sticking you is certified. You know, they're a certified phlebotomist, not Suleen, who got trained in the living room in Bangladesh somewhere. No, not gonna work for me at all. So I just wanted to share that, because I wouldn't want nobody. There's a few people, you know how you don't like people. You're not supposed to hate nobody, right? There's some people you don't like. That pain right there is probably a pain I would wish on somebody I don't like, because it hurt. That stuff hurt. Yeah. So yeah, that's how, that should paint a picture to let you know how much it hurt. Because some people be like, I wouldn't wish this on my worst enemy. This one hurts so bad that I probably would wish it on my worst enemy. And I don't even really have no enemies. But that's my point. It hurts that bad that if somebody you don't like need to feel some pain, oh yeah, let little Shooby Doo stick that little vein. Thick one too, long, sharp. I'm like, she looked like she got one of those tools from the dentist to scrape your teeth. It was that, I can't. It was too much. That's my point. Learn from me and trust that if you're gonna do it, buck up, because if you don't have someone who's being attentive to what they're doing, it is going to hurt. And when I say hurt, I'm not talking about, oh, I'm scared, I'm afraid of needles, it's gonna hurt me, it's gonna poke me. Not that type. I'm talking about as soon as she goes in there, you have a radiating pain that shoots up, and you have no choice but to scream and holler and probably cry, because it hurts. Not like, oh, I got a needle, it's a poke, it's a sting. No. Pain, like yanking away, about to fall off the bed because it hurts type of pain. I'm about to drink this water. I'm about to lay it down, and I'm probably gonna take a nap, because I can't. Even right now, my hand is hurting. I want to go back up there and tell them what else I think and feel. Do you know, I told them I want all my medical records. I ain't come back here no more. Promise you, I ain't gonna bother you, because y'all show ain't gonna bother me. I had to tell them, but I don't know. I have a follow-up. I feel like the least I can do is go get a follow-up. But I realize at the end of the day, a business is a business. And think about all the people who get in these snatch and grab. That's what I call it. You know, that's my little phrase. If the surgery costs $10,000, and I know I was 8 out of 8, that's $80,000 that these doctors are making in one day, snatching and grabbing stuff out, sewing up hernias and putting in lap bands and doing gastric bypass. And for some people it's probably more, for whatever reason, depending on their insurance and however they bill, whatever scar tissue they had to cut through, whatever. I don't know the process, but I know this is a business, and I am a patient / patron. You're not gonna do me. I'm gonna do you first. I don't know what other offers they have for me, but I don't even want it. If it ain't pill form, don't ask me, do you want this to heal better? No, Jesus heals. Trust. Somebody else, I don't know. You're not sticking me no more. Forget that. So this is because it's real and it's raw. I don't even know if I'm going to edit any of this, because I need you to see how real and raw. And if you probably could see how ashy my face is from crying like a fool. It hurt. I don't even want to say it hurt no more, because I think you got the picture. But just be careful. Make sure that throughout this process you're getting the attention that you deserve, the care that you deserve from a facility with medical personnel that are being attentive to your needs. That's the most important thing. If I had nothing else to share, make sure that you're being taken care of, because no one else is going to look out for you. They're doing their job. They're doing what they need to do for the day. Make sure that you look out for you, because if you don't, you're going to probably end up getting hurt. And to me, this surgery, this journey that we're on, we can't afford it. That's how I feel. But thank you for allowing me to vent and tell you what I really feel about this IV therapy. I can't do it.